Just moderate, mild one. Even a brisk walking is okay. It helps improve circulation in your body and things. So it's important you do that for yourself. Then you manage the stress you have. You are a pregnant woman. You are also a career woman. You are supposed to take care of the house. Please manage the stress. Manage the stress. Stress management is key. And if you manage it, it will help you and get a very good family support system. Family support system. So these are some of the things you do in the antenatal period, and it's going to help you, especially going for your regular visit, checkup, sleeping under mosquito net. Don't fall sick. If you fall sick, go to the hospital as early as possible. Don't be your own doctor. All that, because pregnancy is so important. Maybe you have 4, that's why you are playing with the fifth one. Someone who doesn't have one cherishes it. So that's it, AKB. Barnabas will look at the last part of it.
And so just briefly, talking about the last part, that is when you've now delivered. So to help you minimize your risks during those periods, all that we talked about that you can do at the preconception period, and most of the time, specifically at the antenatal period, can be done within the postnatal period. So just to highlight on a few, you need a good social support system. As we talked about how people used to fetch water and help individuals and those kind of things. Growing up, I experienced that. I remember that time we were staying in a compound house, and we were not related within that house. But when my younger brother, they gave birth to my younger brother, that whole week, I mean even more than 2 weeks, I wasn't fetching water, and I was very happy because the women in the house, they were the ones fetching water for us. So I was happy, at least if nothing at all, that I wasn't fetching water. So a good social support network is very good. So that means that if you're a woman staying in the house, those fighting small, you are fighting to get good social support network and exercise if need be. So okay, these are some of the ways that we can adapt or we can use when we want to reduce our risks of developing postpartum depression. But I want to just add quickly that one of the risk factors, of course, that Achu mentioned earlier on are some hormonal changes.
Okay.
Those ones, your diet or your social support network might not be able to have any impact on it, because that is a biological thing. So most of these things that we talked about, some of them target the psychological aspect.
Okay.
So unfortunately for some people, that when they deliver, because of the sudden drop of certain hormones, it changes their hormonal system.
Okay.
That might happen, even though you might experience it. So I'm just throwing it out there that someone might say, oh, I did all these things that you talked about, but still I experienced it. So you should know that if you did all this and you experience it, that is it. But if you do all these things, it reduces your risks to a maximum level. That is why we are preaching that our listeners should adapt this and use it to their benefit.
Okay, thanks very much. It's been a fruitful discussion this morning talking about postpartum depression. And Yaya Tiburata says, Doctor, I greet you. Okay, they both respond. I've responded for them. So those watching the Facebook, let me apologize today. The network is very, very, very bad. Very bad, including the sound. So we really apologize to you as well. But for listeners, there's a money problem. Momo tiene dalet. So those watching on Facebook, we apologize so much. All right, so quickly let's wrap up as I pick your final words.
Yes, so even though we are talking about postpartum depression, it's important that we also look at the fathers, because in this period they also go
almost to me postpartum.
You didn't give birth, but because your wife is in the postpartum period, you may also be affected. And how do they get affected? They can be some men, they like attention.
Of course.
It's just the baby. A small time I have to breastfeed the baby. A small time I have to care for the baby. The baby first, everything. So
they talk sometimes. Everywhere becomes quiet. So
quiet.
That's what happens.
And sometimes the women are scared, especially those who take permission from their husbands before they do or those who need transport fare.
Intimidation, keke.
So that's where the economic empowerment comes.
It's important, seriously.
Yes, very important.
Seriously. So, now, if I'm empowered, I don't nine echo.
So please, when you hear it, don't just preach the gospel, also follow it. Let's try and be doers of the word and not hearers only. The mental health word, not by the Bible to be doer. Yes. Okay. So that's what I'll add to it. And AKB, I don't know, but I think Dr. Beku is a fan of Fila FM. I'm saying this because anytime I sit in his car, he doesn't change his dial. Fila Sports, Fila News, Fila everything. Okay. He's just listening to Fila. Wow. Now 360, he's there. So I want to say a good morning.
Silent listener, one of the silent listeners.
Silent listener. This morning, he's listening right now. Right now, he's listening. And so I want to say a good morning.
No, okay, yeah, try a shout out, Kakra. We'll try a shout out, Kakra.
And Mama Yvonne and the mental health team at Tamale West Hospital.
AKB
come the night. Watch the command. All right, so let's join them and then we'll be back to say bye bye to you.
Party say you be kill so wo, you be sack you be suspend you. Na eya you say. Also empower different camp bi ntia na. Eya you say ba abronya wo camp bi mo endorse ntina de o ye na o ma ye di no na me bisa nsem kaka wo. Esan say abronya musuru no muntumi nya hwe party muntumi nya hwe na de o ye no digu party nim esan say obi nya ho faso ntima ye di na say the last